Thank you very much. And I'm very glad to be part of this group and be able to present just my understanding of what's happening here. I was hoping when I got this invitation that by the time I present, I would be dealing with much less amount of infection so that we would be in a much better position, but it doesn't look like that. It's starting to increase again. So, and also it has been quite a difficult process in trying to estimate the true number of infections, as you might be already knowing that Zoe app has been, their funding has been stopped. ONS, we don't know how long they will go, and testing is in not a very good situation that not many are encouraged to test. So we will have to invest in at least methodology which can estimate estimate the number of infections pretty well. So I will mainly speak about the different aspects of the pandemic. Primarily, I'll deal with number of cases, and then hospitalization, death, and also some amount of discussion on the antibody level that is estimated by ONS. So again, I had to change my graph last night because of new data that has come in. So some of this data might be 2 days old, some are 1 day old. So, and I'll not deal too much with the exact numbers, but mostly with the trend of these infection rate, hospitalization rate, and so on. So as you can see from the number of cases, which we know might be a lower estimate because of the number of testing has gone down, we can see a clear increasing trend very clearly through this line that is going pretty clearly upwards. So that's means that the infection is increasing at quite a high rate, and that besides many other reasons, it's the BA2, and also many of these our restrictions have been dropped. And currently we are averaging 10K, as you can see from the graph, which translates to 70K by this case analysis. But as we will see that from the ONS, it looks like this was yesterday after the weekly survey. So when ONS estimates 1 in 18, that's about 300K per week. And it is obviously quite high in the whole pandemic. As you can see, we had this January high here, but now we are almost reaching that number. So, and again, my slide from Thursday, I was trying to show that Scotland was the only nation that was increasing, and all other nations was decreasing in terms of the percentage of population testing positive. But with the last week, this week's update, it looks like all nations are increasing, and Northern Ireland is always slightly jumpy because of the lower number of samples they have. But this is what the situation is, that cases are increasing. And this is from the Zoe app, which estimates around 175,100. So again, higher than even the January peak that we can see. So this is estimated around 17K, but without kind of delving too much into the different absolute numbers, the trend in all of them are increasing. Now, this is true for many other countries too. I've just downloaded data from our World in Data, and South Korea, Netherlands, Switzerland, Germany, all of them are increasing quite a bit. United States, the United Kingdom is right here, but this might be some countries did pretty well during the beginning of the pandemic, and now the BA2 variant. So those are all the reasons. And these are the colored by the positivity rate. Positivity rates are pretty high in the countries that has higher rate of infection. And this is, again, a insight into the BA2 variant. This is part of my ongoing research, that how are the variants contributing to different infection rate, different hospitalization, different death rates. And now coming to the child cases, which is of primary interest to many of us, we can see that, again, 0 to 14 is on the increasing trend, and 15 to 19 is starting to increase. And we can see that among all the other countries in the UK, Scotland has quite high rate of child infection compared to England, Wales, and Northern Ireland. And this is the child weekly figure. This is a slightly finer age group. So again, we see that we had a drop, but increasing again. And what we can also see is that the child reinfection rate is also pretty high. So that's about 800 of the infections are actually reinfection. And we can see that testing in school has dropped pretty drastically. So these numbers might be very lower estimates of this. Now moving to hospitalization, again, we see this increasing trend that it is increasing and going very much close to the January peak. We have been talking about in the news that, okay, hospitalization is increasing, but ICU admissions are pretty low. Yeah, it is pretty low compared to other time in the pandemic, but we can again see a slight uptick of the ICU hospitalization also. So, and then child hospitalization was very high around end of January. It has come down a little bit, but we have seen that the cases have started to go up, and child hospitalization lags cases by a few days or a week, 2 weeks. So there might be, again, this upward trend in child hospitalization. There's also in the death, we again see that it is lower than the January peak or even the September peak, but it's starting to increase again. Now, the explanation behind death is obviously that we can see that the infection rate is starting to go up in all the older age population. So that might be contributing to the larger number of hospital admission and, unfortunately, some death among them. So this is the primary reason. And also, though we are not seeing the vaccine waning effect yet from the booster dose, that might be a contributing factor. What I'm saying is that we have no research have yet started to show that there is a waning effect, but it might be the case that the waning effect is kicking in, both in terms of infection and hospitalization. Now, the antibody level is an interesting way to look at the current state of the pandemic. It does show whether people have been infected or have developed the antibody through infection. And we can see that they are all at pretty high level. in the whole population. Even at age 8 to 11, primarily, or I'd say mostly unvaccinated, you see 98.1% antibody. These are solely acquired through infection.
5 minutes left, Surajit.
Sure. And we can also see the same thing here, that age 12 to 15 has higher level of antibodies. At least 50% of them might be through vaccines, but this 8 to 11, you can see the beginning of December, they were around 50%, but in the last 2 or 3 months, 50% of them has been infected and acquired that antibody. So this is the vaccination level. As we can see that, we got the vaccination letter today in the morning in the post, so maybe many of you might have got for the 5 to 11 age group. And we can see due to the campaign of vaccination not very prominent, even for the 5 to 11, we are saying that it's a non-urgent one. It's 43% who has got the 2 doses in the 12 to 15 age group, and 71% who has got 1 dose. So we can still see there is some, not a big push for 5 to 11 vaccination, at least not a campaign. So that's something, and compared to the US, many northeastern states and even some western states have very high level of vaccination for the 5 to 11-year-olds. There has been only a few researches about vaccine effectiveness in terms of hospitalization. We saw one research coming from Oxford where it said that vaccine effectiveness in terms of infection might not be huge from the 2 doses, especially against Omicron, but we can see there are very strong evidence that 74%, 73% vaccine effectiveness against hospitalization. So, and masks, also another thing that we never adopted in our primary school, has been shown clearly that it has a very important effect. These are, I will not go into the details, you'll get the slides, but it clearly shows that schools that adopted mask as a policy had much lower observed to expected cases. These are observed to expected in the population. And we can see clearly that 23% reduction in infection by just the use of masks. And ventilation, which is one of my several emails to my school involved ventilation issues. We have still not convinced them about anything beyond open doors. But again, research clearly shows that ventilation can reduce infection at around 41%. So the summary of my message is that clearly we can see that infection is on the rise, hospitalization is on the rise, death came down, but now it's on the rise. And we can, obviously, all of us should campaign for vaccination, masks, and ventilation. Okay, I'll stop there.